Everybody, my name is Chloe Nolan, and today I'm going to be talking to you about what antisocial personality disorder is, what the prevalence is, what the symptoms are, the treatments, the controversies that are really surrounding it. So to begin with, I'm going to give what is antisocial personality disorder. If you look it up on Google on an everyday, maybe on an everyday whim, Google's going to define it as a mental health disorder characterized by disregard for other people. But when you really look into the disorder, it's much more complex than that. Psychologists define it as a pervasive pattern of disregard for and the violation of the rights of others, which is really what this is going to be. They're going to be disregarding people's feelings. They're going to have no remorse for what they are doing. So instead of looking at just a characterization of disregard for others, it's a pervasive pattern of disregard and violation of rights for others. Next, I'll talk about the history of antisocial personality disorder. The original research for antisocial personality disorder started in the 1940s to the 1950s at Washington University in St. Louis and at Harvard University, and it wasn't even to look into antisocial personality disorder. It was to look at the continuity of childhood behavioral issues into adulthood. And what researchers found was that it was a result of an underlying trait, which was the person's personality. And psychiatrists concluded that antisocial personality disorder was a chronic and persistent disorder that rarely remits. One researcher, Dr. Robbins, believed that if the subject improved, that did not mean the disorder was no longer a problem. So someone could feel better and it could seem like they had gotten over it, but because it's a personality disorder, it's so ingrained into someone that even though they improved, it could still be a problem, especially with antisocial personality disorder, which is such a long-lived issue because it is a personality disorder. And a lot of research was done over this, but most everyone had the same conclusion. This was long-lived, it was rarely remitting. Even if someone improved, it could still be an issue further on. Next, I'm going to talk about the prevalence of this disorder. About 3% of the American population can be diagnosed with antisocial personality disorder, and of that 3%, 1 to 2% can be diagnosed with psychopathy. So this is not a very common personality disorder, but it is seen as one of the more dangerous ones. And its prevalence is twice as many in men as it is in women, so you're going to find it more among the men than you will women. But I think even more interesting than that is among prison inmates, it can range from about 50 to 80% prevalence, but only about 15% can be diagnosed with psychopathy. So if you look into the jailhouses, you're going to find that it's way more prevalent than what you would see in an everyday society. And then about 40% of antisocial personality disorder patients have substance use disorder, which can also alter how severe their antisocial personality disorder is, because drugs literally alter everything about your body. It can change a lot of things, and it can change the severity of the personality disorder. This chart right here shows the personality disorders prevalent in American adults, and if you look down at the third disorder, which is antisocial personality disorder, it's about 3.6% of the American population, which is not very huge again, but you also have to give a little margin of error, so it sits at about 3%. There's misdiagnosis or diagnosis while the person was on substances, which is really an invalid diagnosis in and of itself. So just looking at this chart right here, you can see that it's not a big disorder, but again, it's considered a more dangerous disorder because it's associated with criminal activity. So some of the symptoms of antisocial personality disorder are failure to conform to social norms. You're going to see a lot of, they're going to stand out in a group, they're not going to want to do things, or they're not going to want to participate. There's going to be a lot of deceitfulness, continuous lying. Anything out of this person's mouth is rarely going to be truthful or practical. You'll see impulsivity or failure to plan ahead, just doing everything on a whim. If they hurt someone or do something that would be considered hurtful, there's going to be a lack of remorse there. They're not going to feel sorry. They're not going to have any empathy. They'll have reckless disregard for safety of themselves and others. This is not a disorder that they're just targeting other people. They're not even thinking about themselves. They just doing everything on a whim with that impulsivity. And then you'll see them act with they can be irritable and aggressive, and that's why you'll see this more among prison inmates, because it's very aggressive behavior. It's maybe assaulting someone or taking things, stealing things. There's a constant irresponsibility. They're not thinking about others, and if you're trying to get them to keep a job, they're not going to care about it. They're just going to do what they want, really. And the biggest symptom for antisocial personality disorder is the onset of conduct disorder before age 15. Someone can't be diagnosed with antisocial personality disorder until they are 18 or older, but a big onset for that is conduct disorder before age 15. So this is when they're in school. They're going to be bullying others. They're not going to be listening to the teachers. They're going to be belligerent, not doing homework. And if you can treat conduct disorder while they are young, you can help slow or even stop the development of antisocial personality disorder and later on in life. So next step is going to be treatments. Because this is a personality disorder, the treatments are very rare and ineffective, and most say that there is no treatment or that treatment is counterproductive for antisocials because they are so manipulative, because they don't care, they lack empathy. When they go to a therapist, they're not going to listen to them, or they're even going to take advantage of them just to get good marks so they don't have to come anymore. So some believe that just not even trying. There's some therapists that are trying to use animals to introduce empathy with some of the patients, and then some extremes go to chemical restraints to lessen the aggressiveness and the brain activity. But then there's the controversies that really surround this disorder, which is most personality disorder treatment is highly ineffective because personality is so ingrained into someone it's very hard to change. And with antisocial personality disorder, it's such a long-lived disorder, it's hard to get rid of. So people wonder, should we even bother treating it, or if someone is jailed, just leaving them in there, not releasing them back into society, keeping them institutionalized. That's all I have for you guys today. I hope you learned a lot more about antisocial personality disorder. Here are the references I used in my slides. These are scholarly articles and books that have been written over antisocial personality disorders. If you want to learn more, I would encourage you to look into these. I hope that you guys have a good rest of your day and have shed some light on what antisocial personality disorder really is.